Helping a cancer patient, this is about what happens to their body during cancer weight loss that almost no one explains. Welcome to Tea Talk, everyone. If you don't know me already, I'm Danny Cade. Many people assume weight loss in cancer is just part of the process, that if someone could just eat more, they'd be fine. But what I want to talk about today is something most people never heard of or hear of, and it's very real. It's called cachexia, and is a technical way of saying wasting syndrome. And it's something that affects roughly 30 to 50% of people with cancer and up to 80% in advanced or aggressive cancers. It causes the body to lose muscle and weight in a way that's not voluntary and is not reversible with just food alone. That distinction matters because cachexia is not a deliberate starvation of oneself. I was actually accused of that by a nurse one time. Is not poor effort, and it's not a sign that the patient is giving up. In cachexia, cancer changes how the body uses energy. Tumor-driven inflammation, stress, medications, treatments, trauma, all of it alters our metabolism and forces the body into a constant breakdown state. Muscle is broken down for fuel even when calories are coming in. And someone could still be eating, even when the caretakers are doing everything that they can. But in the early stage of cachexia, people can eat without a problem and yet still waste away, which blindsides many families. They see the weight dropping, strength fading, fatigue deepening, but the advice is always the same old thing: eat more, try harder, add calories. But cachexia doesn't respond to calories the way normal weight loss does. That mismatch creates enormous guilt and confusion. When cachexia sets in, caregivers will feel like they're failing, patients feel like their bodies are betraying them, and no one knows how to name what's actually happening or what to do. What makes this more confusing is that cachexia often starts early, undetected, before the extreme weight loss begins, before someone starts to look visibly frail. Subtle muscle loss and metabolic changes can begin unnoticed months earlier, quietly affecting strength, immunity, and treatment tolerance. When cachexia goes unrecognized, people struggle more than they need to. They tolerate treatment poorly, lose independence faster, and the quality of their life declines, and yet is still rarely screened for, rarely discussed, and rarely explained. There's no single cure for cachexia, and anyone promising that is not being honest. But that doesn't mean that nothing can be done about it either. Early recognition matters. Supportive care matters. Individualized nutrition matters, not as a cure, but as a very important part of a larger strategy. Symptom management matters, realistic goals matter, but most importantly, understanding is what matters the most. When cachexia is recognized and named as such, the conversation changes. Food stops being a battleground, care shifts from blame to support, and patients are treated as people experiencing a known medical condition instead of a problem that needs to be fixed. If you're a caregiver and you've been begging, cooking, pushing, or crying over untouched meals, this isn't because you failed. You just need a different approach and an easier way for both you and your person. Now, if you're a patient and you've watched yourself body shrink despite trying, this isn't because you're not fighting hard enough. Again, you just need a different way of getting what you need. Cancer isn't just about tumors. It hijacks the whole body. It breaks down muscle and energy even when someone's eating, making weight loss and weakness just part of the disease itself. Cancer cachexia deserves to be talked about openly, early, and honestly. Not after the damage is done and not as an afterthought, because unexplained muscle and weight loss in cancer is not just a symptom, it's a condition. And recognizing it sooner changes everything about how people are supported through this disease. When I was going through this myself, one of the things my naturopath told me was that our bodies chew up way more nutrients than normal because it's busy trying its hardest to survive and overcome the cancer. And if we're not able to eat, it becomes a death spiral. It's like asking a race car to win without any fuel in the tank. I lost 100 pounds in roughly 3 months. Good thing I was a large lady. And I was running out of pounds, life, and battery. I was all but dead when my naturopath pretty much told me what I needed to do. And because it works so well for me, I put that into a guide that's helped many other people to stop wasting away, has given them their strength and energy back, and made treatments easier for them to endure. Drop the word fuel in the comments and follow me so that I see it. And please watch for my reply because that's where I'm going to give you the guide. It's the best way that I can give it to you. Thanks, everyone. That's a wrap for this year. Happy New Year's, everyone. I hope you had a great Christmas. And I look forward to seeing you in 2026. Make it a great one, everyone. Thanks. Bye for now.